Hi, everyone. My name is Miss Andrea. I'm an aesthetics instructor at the Elaine Sterling Institute, and today I will be demonstrating a diamond tip microdermabrasion. My client has already had her eye and lip makeup removed, as well as had her double cleanse, and so now we're going to prepare the skin by using toner to degrease in areas that are necessary, as well as continue with the service. Now, for a diamond tip microdermabrasion service, this is a great treatment for someone that needs a mechanical exfoliation. We will be using a device to gently but effectively exfoliate the stratum corneum, so the skin that you can see. It's going to buff off any dirt and debris on the surface of the skin, leaving our client with healthy, glowing skin, a smoother texture. There will be brightening to the skin. It's also going to benefit the client by allowing them to receive any further nutrients that we place onto the skin from our serums and our other treatment products, such as our serums as well as our mask. Our client can expect that her skin will be a radiant, as well as able to receive even more hydration from the products that we utilize in service. Prior to beginning my service, my client filled out all of her paperwork and consent forms to have this service. So we did go over any contraindications that would prevent my client from receiving this treatment. You would not do this service on anyone that has had any open wounds or broken skin. We only work on an intact epidermis. If they've had any recent exfoliations, such as microderms, chemical peels, or even waxing services, if they've had any recent usage of retinol or Retin-A's, we would like them to stop using that product at least 7 days prior to service. Also, if our client was pregnant or trying to get pregnant, we may want them to provide us with some additional documentation from their doctor to receive this service, to give consent to make sure that it's the best treatment for them. We also would want to be careful of anyone that has any type of infectious diseases. So I would not work on someone that may have conjunctivitis or pink eye. If they had an active fever blister or cold sore, we would not be able to provide this service until that is completely healed. And there are other contraindications that you might find in your book as well as when you watch this. So what I've listed is not limited to, but those are some important ones as we do this treatment. My client has provided all the documentation and has written her name and dated the consent forms to receive this service, and has confirmed that she does not have any of these contraindications that will prevent her from having the service. Are you comfortable? Okay, perfect. So what my client can expect with this treatment is that we are going to, I'm going to place on my gloves now. I took them off to wash my hands prior to starting this video. So I'm going to put on new gloves. So with our treatment, we're going to use a wand as well as a diamond tip that has little diamond flecks on the tip that are going to be used to abrade the skin for this service. And I also have my little filter. So it's a little white filter that's going to go into the tip as so. And it's going to lay down flat in there. And then I'm going to place my wand and screw it on to secure the tip and the filter onto the actual handpiece. Okay. My equipment, this is my Microderm machine. As you see, has one nozzle, and it also has one button that you're going to place, and you're going to adjust the equipment for the level of suction that you need for your guests. Prior to starting my service, I have wiped down all of my equipment. I have wiped down the holes in which I'm going to connect my handpiece to. I have also wiped down the trolley that I'm using and made sure that everything has been sanitized and cleaned with an EPA approved disinfectant. So for me, I use Barbicide. Prior to starting my service for the day, and at the end of the day, I will also use Barbicide to wipe down my equipment as I'm finished with my service. What my client can expect to experience in this treatment is she's going to feel like a light possible scratching sensation, somewhat like an emery board. It's like a filing away, so it's not something that can be uncomfortable. And I'm also going to test this on my guest before I continue with working on her entire face, so that I make sure that the suction and the abrasiveness of the diamond tip is comfortable to my guest before I continue. I also have a second tip that is a smaller tip that is going to be used for areas that are around the nose, as well as if I want to work on top of the lip line, not exactly on the lips. And if I needed to do some light circles around the eyes, if she were to have fine lines or wrinkles in that area, they can help to buff them away as well. With my treatment, I want my client to hear what the sound of the machine is going to be. It's a light hum. So you hear a light humming noise to let you know your machine is on, and that's at the lowest setting. Prior to me starting my service, I always turn my machines down to the lowest possible setting so that I know where to start, and then I'm going to check my pressure as I work through the service to make adjustments, which is why it's important to have sanitized your machine and disinfected your machine prior to starting, because you're going to have to adjust the setting depending on where you're working. I may need more suction when I'm working in the forehead that has less fatty tissue, and I may need less suction when I'm working in the cheek area. With your machine, there is a gauge, and you're going to place your finger on the tip to see the gauge move to know your level of suction. So I'm going to now turn my suction up. So I'll place my finger on the tip to cover it up completely, and I'm going to keep it there. And then I'm going to turn up my suction. Move my camera back a little bit so you all can see. Okay. So with my finger on the tip, and I remove it, you can see the dial on the suction go down. I'm going to place my finger on the tip. And I usually like to start at a suction that's usually at about a number 5 to see my client's level of comfort. And if I need to decrease it, I know to decrease it, or if I need to increase it, I can also increase it. Okay. Camera a little closer so you all can see. Perfect. Okay, are you comfortable? Okay. So I'm going to turn my client's head to the side, and I like to use either her collarbone or at least the side of her neck just to check the level of suction to make sure it's comfortable. So you're gonna let me know if the suction is comfortable. How does that feel? Fine. Okay. When you do a diamond tip microderm, you're gonna work in a hashtag method. So your movements are going to be up and down very quickly, just like a pound sign or a hashtag, okay? And we're gonna work from one side of the face, and then I work to the other side of the face, and then I'll work down the middle. And I'll show you how to maneuver those different areas. So I'm gonna start on this side because I know it's easier for you to see. I take my thumb and I hold the skin taut, and I'm gonna pull back so that I have an actual tight space to work with my client. And then my pointer finger, I'm gonna place right between the brows because I never wanna press down on my client's eye socket. This is very uncomfortable to be pressing into the client's eye, so you wanna be careful where you position your fingers. So I'm gonna start with the middle of the forehead. I'm turning her head to the side so you can see a little bit. And I'm gonna work in a hashtag movement. So I'm gonna start with vertical, and then I'm gonna go horizontal. Pressure, okay? Vertical, and then horizontal. So I'll move this way so you all can see. So first vertical, horizontal. Vertical, horizontal. I remember when I was a student with Miss Elaine and she taught us how to do the microderm, she would sing one way or the other. I'm gonna find you. I'm gonna get you, get you, get you, get you. I still remember that, even since 2013. So when you do this treatment, you'll find that your client's skin gets a bit ashen, which is normal, and that's normal that we have that happen. But I also am able to see where I've actually exfoliated the skin and to see if I've missed any area. So once you're gonna move, And you're going to keep going in a logical pattern. And I like to take small sections so that way I have control over the skin and I'm able to truly hold the skin taut. Okay, so I'm going to go in this next section. And then I go back. So, vertical and then horizontal. My pressure okay? Okay. Vertical and then horizontal. And if you feel like you're dragging the skin a little bit or it's pulling too much because you get to an area where it's softer tissue, then I'm going to adjust my suction. So I'm going to put my finger back on the tip. I'm going to adjust my suction down just a small, tiny bit. Because what I definitely do not want to do, which could occur, is that I could cause my client to have like a stripe. So that's an area that there may have been too much suction or too much pressure from my hand that caused a line to occur. And we do not want that to occur. And with this treatment, you want to always be mindful that you do not need pressure to exfoliate the skin. The tip is actually going to do all of the work and the suction. I'm just guiding where I would like it to go. Okay? So again, vertical and then horizontal. Pressure okay still? Vertical, horizontal. So when it comes to the cheek area, I'm going to place my finger right on this orbital bone, and I'm going to take it in small sections. I don't want to go down in long strokes because it can be difficult, and you might end up missing an area, or you might end up it being a bit uncomfortable to your client or risk having the strike happen. So I take small areas that I can cover, and this is actually allowing me to do 2 passes on a guest at once. Okay. So finger on the orbital bone, holding the skin taut. And I'm working between my fingers, going vertical, and then I'm going to go horizontal. Pressure still okay? Okay. And I do check in with my client throughout the service because I want to make sure they're comfortable. I'm going to turn your head to the side. Thank you. To make sure they're comfortable and that my pressure is not too much. But gauge for me is that when I work between my fingers, I make sure I'm hitting my fingers so I'm staying in the right place. So I'm going to go vertical and then horizontal. Okay. Vertical and then horizontal. All right. So now that I'm around her eye socket and I feel like it's a little bit more build up here, I'm just going to hold this skin taut really quick and go vertical. Pressure okay? And then I'm going to place my finger here just to get a good grip, just to make sure I don't touch any of that soft tissue by the eye. Go hold up. Okay. All right. So one thing we do not want to forget is the eyebrows. So with the eyebrow, I'm going to hold the skin taut, and I'm going to do circular motions in the brow. This is also great for a client because often we don't exfoliate this area of the skin, but you want to make sure they haven't had any like recent treatments such as microblading or brow tattooing. At least 30 days, we want to let the skin heal before we work in that area, and we don't want to fade that area. And you just want to have that conversation with them so that they are okay with having this treatment. I did have this conversation with my client prior to them actually receiving this service as we started with our consultation and that conversation. When it comes to working in between the brow, I place my ring finger, because it's the least amount of pressure, on the bridge of the nose. You haven't had any recent procedures on your nose, have you? Okay, because I want to make sure if she had had any rhinoplasty or anything, that I'm not going to cause any discomfort. So you don't have any discomfort in the nose either? All right, so I'm going to place my ring finger, just some light pressure, and I'm going to use most of my pressure with my thumb to pull the skin taut and to then work in the hashtag area of the brows, in between the brow. And let me know if my pressure is too much, okay? All right. Continue to move one way. or the other. I'm gonna find you. I'm gonna get you, get you, get you, get you. Okay, pressure still okay? All right. Okay. Pressure still okay? All right. So the great thing about a microderm is that it can be done in about 5 to 10 minutes in a service. This is going to take place of your exfoliation. Your client's going to get immediate results after this treatment, which is awesome. And it can be done during like a lunch break. Because it's such a quick treatment, pressure okay still? They can really get a really great exfoliating treatment in a fast amount of time. So with this treatment, there are some aftercare information that you want to provide your guest. I have an aftercare handout to give to her so that she's able to take it home with her to make sure that we don't do anything that may cause any kind of irritation to the skin after this treatment, because we are removing dirt and debris and dead skin cells that have set on the surface of the skin, which is kind of made like a little bit of a barrier. So we are leaving the skin vulnerable. So we want to make sure that we are giving our clients the proper aftercare to reduce any likelihood of any adverse reaction. So the one thing I want to make sure my client has is that they have some sun protection. I do not want them to go out into the sun without any protection for risk of hyperpigmentation or things of that nature, especially a woman that is rich in melanin. Want to make sure that she is protected, although everyone needs sun protection. A client that is going to receive this treatment, even on their consent form, we're asking them, do you agree to adhere to wearing some sun protection? And it's important that they have that. This is also going to help to reduce the likelihood of having the sun be damaged, the skin be damaged by the sun, reduce the likelihood of having wrinkles and fine lines. And I also want to make sure my client leaves with professional products that are going to help to continue the level of professional results she's received from this service with me. So I'm going to make sure my client goes home with a cleanser and a great moisturizer and sun protected. Okay, can you do me a favor and tuck in your chin for me? Okay, perfect. And then tuck in your lip. So when you're working on the chin, I'm going to hold my client's skin taut here, and I usually place my finger right below their bottom lip, or right at their bottom lip, to work very quickly, doing the hashtag still. Pressure still okay? Okay. And if you need to, you can relax your lip. If you need to, you can hold the skin taut, and you can also do little buffing circles. Tuck your bottom lip in one more time. You can do buffing circles in this area. You find that a lot of times our clients have some buildup. Just make sure we're holding the skin taut. Okay? So if you needed to, we can do some little light circles in that area. Or we can do the hashtag one way or the other. Okay? You can relax. Now I'm going to work above my client's top lip area. So take your lip in for one more time. Going to hold the skin taut. And so we're just going to buff in a vertical pattern. Comfortable? And if you need to, you can also do circles. Just make sure you're holding that skin taut. Okay, you can relax. And I'm also looking to see if there's anywhere that I missed. turn. I'm going to save the nose for last because at that point I'm going to change the tip of my microderm and use a more narrow diamond tip that is going to allow me to work around the nose and really get any dead skin that may have built up in the curves of her nose. So now I'm going to work on the other side. You won't be able to necessarily see it, but I'm still going to be doing the hashtag movement, starting back from where I left off. So I can see a clear line of what has been worked on because it has a bit of an ashen look versus the other side that still looks like it has a bit of oil to it. Okay. Gonna work one way. And let me know my pressure's still okay. Okay, so additional to your aftercare of having some SPF, I would like for you to refrain from using any exfoliating cleansing products. So no cleansers that have any alpha hydroxy acids or beta hydroxy acids in it, at least for the next 72 hours to 2 weeks, preferably 2 weeks. For this treatment, you're going to see results today, but for you to get the best results possible, I encourage you to do a series of 4 to 6 treatments coming at least once a week. So I would love to see you next Monday at the same time to do an additional microdermabrasion so we can continue to keep these results and actually push the skin a little more. I do see areas that we could work on to do some more, to make extractions even. Now, ladies and gentlemen who are watching this video, I would not necessarily encourage extractions after a microderm. You really need to see how the skin is responding because if the skin is very sensitive, because what they could experience is a little bit of pinking, a little bit of erythema. Sometimes the skin can feel a little sensitive, kind of like a windburn. I would not do extractions on skin that may be uncomfortable. So you want to be mindful of what the skin is telling you before you go on to do and assume you can do extractions. It may be that I need them to come back, next week, and then we can do extractions, and maybe we'll do a different service than a microderm. This is just really helping to prep the skin by removing the surface dirt and debris, especially for someone that may not have had any type of real exfoliation prior to. All right, the pressure's still okay. Okay, so also for your aftercare, we want to avoid waxing of the face for at least 7 days at a minimum. You are welcome to get the lower brow wax if you'd like to, but I would not do any facial waxing of the chin, cheeks, or lip or anything of that nature because that's additional exfoliation and could risk causing hyperpigmentation or adverse reactions, and we definitely don't want to do that. Pressure okay still? Okay. Okay. So would you describe this as feeling like, what does it feel like for you?
Like light scratching.
Light scratching? Okay. Can you feel the suction as well?
Not particularly, no.
No. Okay, you just feel the actual tip of the diamond. Okay. So with your client, the best candidates for this treatment would definitely be someone that may have hyperpigmentation and kind of wants to brighten the skin, even out the skin tone. Someone that may have different textural things going on as their conditions. Someone that may have oily skin can benefit from this as well. Someone with mature skin can benefit from this treatment. Someone needing overall exfoliation can benefit from this treatment. Okay, this way. All right. So as I said, how often this treatment can be done can be once a week. And I would do once a week, at least 4 to 6 treatments, and then once a month for maintenance. see. Reach out for me. Straight down here. Okay, so I'm just making sure there's nowhere that I missed. Because I want to make sure I give my client a really even exfoliation. Okay, perfect. So I'm going to turn off my machine for a second, and I'm going to change my diamond tip. Now, are you a client that likes to see what came off of your skin? Okay. So with your diamond tip filter, I have two filters because sometimes it's just better to change your filters. With my filter, I can kind of show you all some of the buildup that came off the client's skin, which is great. So they got a really good exfoliation. So everything else I place on this client will really be beneficial to them. My tip is now used. I'm not going to place it on my clean station. I'm going to place it in the items to be disinfected box. And each station should have one. Make sure you have one before you begin your service because you're going to need to place any dirty implements, whether it be a tweezers, a mask brush, your diamond tip wand, your diamond tip heads. You're never going to want to place any dirty implements on a clean station, okay? So, sanitize my hands. Okay, I now have my smaller diamond tip head, and I'm going to place a new filter, which is here. My old filter I threw in the garbage. And I'm going to screw it on the wand. One thing is so important. Please make sure when you're finished with your diamond tip, you take off the head, take out the filter, throw it away. Please do not try to cleanse this without remembering to take out that filter, because that's where all the dirt and debris and bacteria is. And we definitely do not want to find old filters in any diamond tips as we continue to work on clients, okay? So I've secured it onto the wand. I'm now going to turn the machine back on. I'm going to check my suction again. It's still at a good pace. I can actually turn it up a little bit. Okay, and now I'm going to work around the nose area, along as well as with the bridge of the nose. So I'm going to hold the skin taut from between the brows and pull it towards me. I'm going to give a little bit of pressure on the nose, and I'm going to do small circles. So small, little, tiny circles. Just to buff, buff, buff away. Kind of move my fingers out the way so you all can see. So this is what the little head looks like. Got a little circle. And small, little, tiny pressure, okay? Okay, so I'm just buffing, buffing, buffing away. Especially on the bridge area. We get a lot of buildup in this area. So I make sure I buff all that away. And then when it comes to the nostril, I want you to breathe out of your mouth or breathe out your nose. And I'm going to place one finger over one nostril and I'm going to pull the nose to the side because I want to have the skin as taut as possible. And then I'm going to make nice little circular motions around the nose, just like it's buffing away. Pressure, okay? And just be careful of you actually holding someone's nose because it can be uncomfortable. So you kind of just want to hold it to the side, have them breathe out their mouth or breathe out one nostril. And I'm just going to buff away. This is tickle. Okay. Very light pressure. The tip is what's doing the work. And you can kind of go back and forth. I'm sorry, you all, you might not be able to see that. You can go back and forth along the nostril. Okay. And when it comes to the nostril, you're going to do circular motions. Circular motions, gentle pressure. Even when you're working on the top of the nose, gentle pressure, circular motion. Make sure you get the tip because we get a lot of buildup in this place. If you need to stand up to see, you can. I'll work on the tip a little bit. Let me know if my pressure is too much. So that's one side of the nose. Good. Okay. Now I'm going to make sure that I can do the other side. So, okay, turn it a little bit. I'm going to have my client breathe out of her mouth or her nose. And I'm just going to hold the skin taut and just gently work on this side. Circular motions, light pressure. Making sure I go along the curvature of the nostril. Okay. Once you have completed, you know what, I do want to do one more area. Can you tuck in your chin for me? And then tuck in your bottom lip. I'd like to go over this area because we do get a lot of buildup, and I just like to do nice little circular motions over this area just to make sure. If you wanted to work with someone and you wanted to reduce fine lines and wrinkles, you can hold the skin taut here. And before you get into the soft tissue, this area out here, and just do light little circular motion in this area. Just gently. Pressure okay? Just make sure you're always holding the skin taut. As you work, if there's any areas that you might think you want to go over a little bit, just to make sure. Some little areas I want to make sure I saw some little extra dry patches. Okay. Now that I'm finished with my microdermabrasion, I'm going to now take off the handpiece, and this is a suction that you just place the tube in, so you're going to just twist it off, and it comes off just like that. So this tube is inserted into the holes. This handle is inserted into the holes, and then when you're ready, you just pull it right off. I'm going to push my equipment back because I'm going to need to sanitize it and sterile and disinfect it before it's completely put away. For my wand, I'm going to take my wand, I'm going to place it into the container that says items to be disinfected. I'm going to empty out my little filter, and then the head of my microderm, I'm going to also place it in items to be disinfected. And then I'm going to take some cool sponges, and I'm just going to wipe off any excess dead skin cells or anything on the skin. You are also welcome to tone, which I will do in a second. Okay, I have a cotton round, and I'm going to place some toner on this. So this is our daily nutrient toner. I'm going to then proceed with the mask that is going to be the best for my client's skin conditions and skincare concerns, and then follow that up with serums and then SPF. I would then give my client any the aftercare information that we spoke about while doing the service. I'm going to provide her actual document that looks like this, her aftercare information to take home with her. I'll go back over with her to let her know the regimen that I would like her to have when she goes home. and any behavior that I want to make sure that she does or does not do. One, of course, is wearing SPF, and then also not taking any hot showers or working out or steam after having the service tonight. Save that for tomorrow or for at least 12 to 24 hours so that we don't cause any adverse reactions to the skin and don't bring any heat to the tissue. Because in this service, we do not provide any steam or any hot towels. Okay? So this is the close of my actual demo of the diamond tip microderm. I'm available for you all whenever you need me. So please let me know if you have any questions or concerns when we return to school. Have an amazing day. And thank you very much for watching.